So I have an interest in esophageal disease, so acid reflux, any trouble swallowing. So I have an interest in those patients, and at Ganj we're doing pH testing. One, it helps us confirm whether the patient actually has acid reflux or not, and secondly, it helps us quantify how much acid reflux they have, because depending on that as well, the approach for treatment can differ from endoscopic options versus surgical options versus how many medications we should treat them on. Studies have shown that 1 in 6 Americans actually can have acid reflux. So that's a big number. It's a very heterogeneous disease, so it can be from a whole variety of things: diet, not exercising regularly, to things, anatomical problems like having a hiatal hernia, bypass surgery, so they can have acid reflux as well. There are quite a few patients who may not have any symptoms for acid reflux, but the problem is if you have chronic exposure to acid in the esophagus, that could cause permanent damage to the esophageal lining, which could predispose you to getting esophageal cancer. So that's why I think it's very important that if you have any symptoms like heartburn, regurgitation, even infrequently, that should still be evaluated by a physician and looked into in details. It's a whole variety of causes, and the treatment for that will depend on what the underlying cause is. And again, it's a combination of diet, lifestyle modifications, medications, and sometimes endoscopic procedures or surgery. Each patient has to be looked at individually to quantify what their acid reflux burden is, and then accordingly approach their treatment strategy.